Hey family, this is Dr. G with BeOrganic with Dr. G. I apologize for the time in between the videos. It's been really busy in the office. Exciting, we got a new doctor in the office, so trying to get him trained in and get everybody up to that status. But I'm really excited to do this video for you. I made a promise to one of my patients this week to hold me accountable to making this video. So today's video is going to be about foam rolling. We're going to do a full body foam roll, upper back, legs. And the cool thing about foam rolling is it's not just about making the muscle get massaged or breaking down scar tissue. It's also about re-educating the body and helping the body learn how to work together. Just like the last two videos, the plank video, the squat video, it's all about the core. When the core is engaged, the body is stable. We want to teach the body how to move in that position while the core is engaged. So when I instruct people to get a foam roller, you want to try to get a high density foam roller. So you want to be able to see these cells right in here. You don't necessarily want to get the one that's double layered because it's going to wear down faster and it's not going to be as firm, which means you're going to kind of get to the point where you don't really feel it anymore. So you want high density where I can't even squeeze this right now. This is a little bit shorter than I like to use. Experts at foam rolling can probably get away with using this, but if you're new to foam rolling, get a 36-inch one. It makes it a lot easier. You're not trying to balance on it. So we're going to start today with the upper back. Now the intent of foam rolling is to try to help the body just get used to having some global movement. When you're doing the upper back, you might get some pops or cracks in the upper back. It doesn't mean you're getting adjusted. It just means you're helping the body move. So if you can make this foam rolling routine part of your kind of daily routine in the morning when you wake up, it'll really start to help your body also retain the adjustment, but learn how to move a little bit easier, and you feel less stressed at the end of the day. So we're gonna start with the upper back. You're gonna interlace the fingers like this, and you create a hammock for the back of your head like that. You wanna start at the base of the neck. We're not doing into the neck. You go from the base of the neck and you're gonna stop at the ribs, right about here. Ladies, it's gonna be basically at your bra strap. So roll down, create that hammock for your head. Let your head fall back. You wanna bring your elbows together. That gets the shoulder blades out of the way so you can actually reach the spine. You're gonna bring the hips up about 2 to 4 inches off the floor, but you're gonna tuck under and squeeze that core all the way around. We don't want to let the body go like this. We want to keep it tight. So we're going to roll down, letting the head stay heavy, letting the chest stay heavy, but keeping this core contracted. As you go, this will start to allow to almost come back to where your head can touch the floor. That's good. We just don't want to let this stay uncontracted to where you're going like that. You want to keep it contracted so it helps the body work together. You're going to go down, come back up, nice and slow like that, staying focused. It's almost like you have a sandbag on your chest and your waist, pulling that down. Just don't let the butt hit the floor. Next, we're gonna go to the legs. You're gonna start IT band. This is basically gonna be in a halfway, kind of a side plank. You're gonna start halfway down the leg. That way you have enough room to go up to here and down to here. Biggest thing when you're doing the legs, don't go over this little bone out here on the side. It's the greater trochanter of the femur. We don't want to go over the bone because it puts too much pressure. You've got a little knuckle on it. It's called a bursa. It's basically a cushion. We don't want to crush that cushion. So you're going to roll up to that bone and then back down. Same thing with the knee, not going over the knee. When we flip around and do the back, you're not going to go over the butt bone, and you're not going to go over that little knob that comes out of the back of the hip. So we're going to come down into that side plank. If you notice, head, belly button, and ankles together, we all want to be in line, okay? This is going to hurt. It's okay. Every day that you practice and you work on it, it gets better and better. It gets easier and easier, I promise. If you continue to do it, you'll thank me later. So we're going to go down all the way to the knee, come all the way back up to that bone, keeping that core tight, the body in that plank. If this is too much pressure for you, Try it first. If it's too much pressure, you can bring that top leg over. Notice how the rest of my body is still in that plank, but you're gonna push down on the floor to where you can almost lift the leg off the foam roller. That way you can control the amount of pressure. You're gonna do that, do the IT band, which is that band on the side, then you're gonna roll and do the quad. If you wanna get really intense with it, you can tuck that leg in and then hook it so that it stays tight and you're really getting into that quad. You're gonna start all the way down at the knee, coming all the way up. This one you can go past that little bone because you're not actually rolling over it, staying in that plank, all the way down. All of these you only need to do about 3 or 4 nice, slow, controlled passes. When you're doing the quad, you can stay there, come all the way over to the middle, staying in that plank, squeezing the core, squeezing the glutes together. Really making sure you're keeping that spine straight. You're not going like this, you're not going like that. Come all the way over, like this, down into that upper hip flexor. You can get into there too. You can stay straight. You can put the knee down to give you that stability if it's too much. Then we're gonna come to the hamstring. Stay on one hamstring. Come up into almost that push-up. You can cross over. Keep the heel and the toe back like that. We're gonna slide down all the way to that bone. Don't go over that butt bone that you sit on. And then don't go over the back of the knee. Roll through there. You can turn kind of sideways, get that outside hamstring, the middle hamstring, get the inside hamstring. And then we want to get into the glute. So I'm going to work on this side of the glute. Shrim's going to put this foot down. This side is going to come over this way, okay? You're going to be kind of at an angle. So I'm going to come up and sit on it. There's basically a triangle that you're going to work in. You're going to stay in that triangle, still core tight. This one's a little bit more kind of off balance, but rolling through that, you can come all the way over to the side. Anywhere that's muscle, you'll feel that kind of burning pain when you get on that spot. If you want to, you can spend like 5-10 seconds and really just sit on it as you progress. But that's what we're gonna do. Again, this is gonna be one of those videos that you're gonna have to watch a couple times. Really pay attention to all those little cues that I'm giving you so that you don't hurt yourself. We always wanna try to help the body, not make it worse. So this has been Dr. G with BeOrganic with Dr. G. I really appreciate you guys watching the videos, commenting, posting, asking questions. You guys have a wonderful day. Love you.